But someone could do better. Someone could do better. Anyone who can do better than the first.
Medication? Get the medication that you might need for school?
That's another one. Someone could do better than that.
Should be everyone's basic human right to have access to
Well,
What do you think about that answer, everyone, please?
Yeah, it's good.
Very
Good.
good. Well done.
And someone could do better than that. Thank you so much for that answer. Someone, I need something slightly. Okay, I think this is really a good audience. Thank you so much. Probably what I would say myself, I think we need to really ensure that nobody in your community is excluded from accessing that health care. Simply because I'm just going to look at, okay, the theme of this conference, I think, is saying that practice management is like a box of chocolate. When you share, everyone smiles. So I'm just going to say that it's really important that everyone has a GP, simply because everyone will stay healthy, safe, and well. I think that is it. Because if everyone is safe, healthy, then we are all safe. I think we saw what happened in the pandemic. If we are not very careful, I think the whole world will have gone. But if you have the access and you know that Marina is safe, I can only be safe when Marina is safe. So, hope that makes sense. Thank you. Why should everybody be able to access health care? So, we're looking at all that. It is enriched that human right is a human right. I think one of the answers we got is that it's a human right, because we are bound to access the right to health for everyone. And I think it's based on the clinical need and it's not ability to pay. So it's important for public health and prevention of the communicable diseases, vaccination, health promotion is well-being, and then drug alcohol treatment. And good health, like for mental health, if everyone can get, we can look at all these issues that they can be looked after if one has access to health care. And it's cost effective, because it's better to get someone treated other than when you get to the point where a person has really deteriorated, and then in the end, still, when you start on that person when they're in that state, it's very likely costly, and of course, in terms of life saving, then that person cannot be saved. And we look at ideas like the health inequalities, the cost of that. But I think we are not here to again blame or accuse anyone, but we are looking at the access to, I think the the costs. If we look at if the primary health care is accessible, then we don't have to go to and we can do away with all those people going to A&E, or even people even the we save those queues in the A&E. Then I think another thing is that what I can say basically, having access to primary health care is the key to access that wider network of health care. So if a person is already having that, then it means that everything they can access, and it will be very easy for everyone in that sector. So for the health inequalities, we have got all, as we mentioned, that people with insecure immigration status. We've got people who are experiencing homelessness, as my colleague mentioned, people from Gypsy, the Rome and traveler, and people who are selling sex. So these are people who are, we've got other groups as well, like people who have experienced domestic violence, people with learning disabilities, we've got people who have been recently released from prison. So the health inequalities experienced by inclusion health groups, they are unjust and unavoidable. So your GP surgery may be based in an affluent area, but despite this, there may be still pockets of hidden deprivation facing particular patient groups across your neighborhood. So that's why it's quite important really to know your community and know your neighborhood, and then seeking further insight into the inclusion of health groups in your local population and that needs will be central to successfully tackle all these inequalities. These are some of the barriers to health. These are some of the barriers to health access. Accessibility, like people not English. Most of them English is not your first language. Even me, it wasn't my first language, but now I think I can say something and you understand me. But ability to read and write, or even to use a smartphone, or even having one, navigating the NHS information and that's the entitlements, the fear of sharing your data with the Home Office, lack of ID or proof of address, the fear of like just being judged and prejudice, and lack of funds maybe to travel and go to the GP. So it's all a cross section of barriers, and these are all things that we might look at when we have to consider who is who and what has really helped us, stopped us. Okay, what has been an issue in registering with the GP?
So how much of a problem is this? So the Bureau of Investigative Journalism did a mystery shopping exercise 2 years ago, so 2021, during the rollout of the COVID vaccine. So obviously that was a point where it was very important that people were registered with a GP so they could have an NHS number, they could use the national booking system to book a vaccine. But they contacted a third of GP practices in 10 locations across the UK, and they chose areas where there were a high proportion of people that were living in the UK but hadn't been born here. And they tried to register a hypothetical patient, Rosa, a woman in her 40s without ID or proof of address. And as you can see, quite a high proportion of those practices said that they wouldn't register the patient. And only 24% of the surgeries would register someone without proof of ID and address or legal immigration status. So clearly this is a problem nationally, where people that experience these barriers are having ongoing struggles to access primary care and GP registration. And obviously the findings of that study conflict with the NHS England guidance on registration. So we know that anyone in England can register and consult with a GP without charge, and nationality and immigration status are not relevant to GP registration. So whether someone is undocumented, an asylum seeker, someone that's just been in England for a few days, and anyone can register with a GP, and they don't need to show proof of ID or address in order to register. If patients don't have a fixed address, or they are scared to share their address because of implications of data sharing and they're worried about the Home Office, for example, tracking them down, then they can register with a practice address or another address in the community. So a friend's address, a church, a mosque, a community centre, having some kind of arrangement to maintain contact with those patients. Any suspicion of fraud should be directly handed over to the NHS County Fraud Authority. And then where there is that uncertainty on how long patients are in the area. So the example in the guidance is people seeking asylum who are housed in Home Office accommodation. And these people often are placed in hotels across the country, we've all probably seen on the news. And hotels are classified as temporary accommodation, but actually people are staying in these hotels for very long periods of time, in most cases over a year. So extended periods of time in temporary accommodation, which isn't temporary at all, and often has quite significant impacts on physical and mental health. Because of the fact that it's not temporary, that means that these patients should be registered as permanent patients. So that means they'll have access to an NHS number if they haven't registered in the UK before. They'll be able to be referred to other services, and their medical records will go with them. So that's kind of key. So the response to this issue, but also recognising the ongoing and increasing pressures on primary care, was the Safe Surgeries network. So we established the network in 2018, so it's been 5 years now. So it's about removing some of those barriers to registration and aligning with the NHS England guidance. So it's not necessarily offering an additional service, it's just about having those resources and the guidance to align with that, whilst making sure that no one is turned away from the GP practice. So the process of becoming a safe surgery, the very first step is signing up through the form. So you'll see the QR codes on the table, that links to the form to sign up. And we'll show it later, I think, on a later slide. And then once you've completed that form, we send an email with the process, with all of the resources and links to training opportunities. So the first step is signing the Safe Surgeries Declaration, which is something that can be displayed in your practice to show your commitment to working towards minimising some of those barriers. Completing Safe Surgeries training and reviewing the resources, so we've got a wide range of resources, which I think we'll talk about a bit later. Then reviewing your practice registration policy, so obviously the easiest way for most sustainable change across the practice. Displaying posters in the practice and on your website, and we've got some copies there, so at the end of the session please can I get some from us, and then that's at least one step of the 5 done. And then the ongoing part of that is engaging with the Safe Surgeries network, so engaging with our newsletter, sending us any updates, any examples of good practice that we can share across the national network. Oh, I didn't. Well, there's the flowchart that I just talked through. So yeah, they're the 5 steps, and the first step is the sign-up form. I'll keep an eye on the slide.
Yeah, I think it's a bit of multitasking, pressing and...
I know, it's too difficult to read something and
we
press a
get
button.
yeah.
That's too much for my brain.
So what is a safe surgery? A safe surgery is any GP practice which commits to taking steps to tackle the barriers to healthcare faced by undeserved communities. Small changes in the practice will ensure that lack of ID or proof of address, immigration status or language do not prevent patient registration. The practice is signed up, receive free training, resources and support to align with NHS England guidance on GP registration. And with this map, which we can see there, we've got 1,600 safe surgeries across England, and we just need this number to grow, because that is where we know that at least everyone is taking effort to make sure that all those undeserved communities have access to a GP. So it's just working with you to improve services of the marginalized groups to access primary care, and of course support